Hi, I'm Dr. Jeffrey Riopel from the Riopel Cosmetic Surgery and Laser Center in San Ramon, California. And this is one of a series of videos to tell you a little bit about our practice. I'd like to talk about liposculpturing for men. Many men have excess fat in various places. We tend to gather it around the belly and the love handles and the breast area, particularly as we age. And once we reach a certain age, if we've gotten fat there, it becomes very difficult to lose that fat. We actually can exercise and do everything right and still have fat left in the area. Well, luckily, we now have Smart Lipo, Ultra, and Vaser liposculpturing. This procedure is ideal for men. As men, we often need to be back at work very quickly. We lead active lives. We can't afford a long period of downtime. In the old days, when I first started doing liposculpturing, we had to do it with tumescent anesthesia, with just vigorous, hard work to get the fat out, and this was fairly traumatic to the skin and to the undersurface, which led to long healing times and sometimes gave a higher risk of some irregularities of the skin. Nowadays, though, we have several great techniques that we use to aid us in doing liposculpturing. This is the most recent issue of the Aesthetic Guide and talks about Vaser liposculpturing. This is the June issue of 2010. Same time I'm doing this production. So this is the exact same procedure that we do in our practice and have been doing now for several years since it arrived to become available to us. Vaser liposculpturing involves melting the fat with an ultrasonic probe called the Vaser. And this is all done awake, so very, very low risk in terms of risk of serious complications. Most of the risks of all complications came from general anesthesia and large volumes of fat removed under general. However, now we do all of our liposculpturing under awake anesthesia using what we call tumescent. Tumescent is a dilute lidocaine or novocaine type solution that numbs the skin and the fat. So suppose we want to take an area of fat on the belly. For example, a couple weeks ago I treated a patient with a fairly large area on the belly, looked great otherwise. And what we did for him was we brought him into the office, we prepped him, we marked the fat, we then anesthetized the fat with some little injections into the fat. Now the fat is not very painful to inject, so we can do this procedure fairly painlessly. So we injected a volume of fluid into the fat. Once the fluid was in, we took our Vaser, and again the Vaser is the probe being talked about in this issue, and we put the Vaser in and we ultrasounded the fat, which melted the fat. It's much like turning a cube of butter that's hard into a liquid if you put it in the microwave. Once the fat was melted, we can then suction out the fat very easily using a suction probe, again through the little tiny ports which are put in multiple places around the abdomen. Once that's done, if the skin needs to be tightened, then this is where Smart Lipo comes in. You may have heard of Smart Lipo. Smart Lipo is a great technology, particularly for tightening the skin, because you can heat right under the surface of the skin and that contracts the collagen. And heating the collagen also stimulates it to grow. So over the next 6 months, the collagen is growing. As it grows in a spiral formation and tightens greatly. So 3 parts really to the procedure: numbing, vasering, liposuctioning, and the 4th part, if needed, is the Smart Lipo to tighten the skin. Recovery period is usually just a few days in terms of back to work. People look quite good at 2 to 3 weeks out, although the final tightening you often don't see until 6 months. These technologies have allowed us to get smoother results with much less trauma to the patient and a much quicker back to work time. So patients very commonly come in saying, wow, I feel like I look great. You know, I always have looked good every place except here, and now I finally look really good here. We can do for men, the most common areas to do are the abdomen, the love handles, and the breast area. The breasts are particularly gratifying to perform because many men who have large breasts are very, very self-conscious of it. They won't go to a swimming pool and wear a swimsuit because the chest and the breast area are exposed. So we can do a great job with the chest and the breast nowadays because of the Smart Lipo Ultra that we have. Whereas before it was a very difficult process to get through the glandular tissue to get enough fat out to make a big difference. But now with these new modern technologies, we can really do well. One patient I had came in and said, wow, I just feel fantastic now. This is something I've been self-conscious of since I was a teenager, and now it's totally gone. And we hear those comments all the time. So we'd like to tell you more about this, and it's best done in person. So we invite you to come into our office. Please give us a call, 925-275-9333. That's 925-275-9333 in San Ramon, California. Also, feel free to click on any of the links at the bottom portion of the page to find out about many of our other procedures. And thank you very much.